What are some newer therapies with different mechanisms of action to consider at first relapse?
So at first relapse, I guess technically Selinexor, which is an oral drug, which is a different mechanism of action, targets a protein called XPO1, which is a transport molecule on the surface of cancer cells. This has been approved in combination with bortezomib. It's an option for patients with one or two or three lines of treatment. One of the challenges that is toxicity management with selinexor. It is a pretty significant toxicity, at least at the doses that was initially studied and approved. So we're still tweaking and understanding better of how to manage side effects that come with selinexor. It's also in the context of what other choices are available. And as we discussed, we have half a dozen other combinations that you could consider. But in terms of new mechanisms outside of these three classes of drugs and the CAR T cells and the bispecific, selinexor would be yet another drug, either by itself or in combination with other drugs.
Well, let me say Venetoclax is really quite effective for patients who have an 11-14 translocation, sometimes combined with other drugs like the proteasome inhibitor or an IMiD. Very, very effective.
On April 5, 2024, the U.S. Food and Drug Administration has approved Carvykti for the treatment of adult patients with relapsed or refractory multiple myeloma who have received at least one prior line of therapy, including a proteasome inhibitor and an immunomodulatory agent, and are refractory to lenalidomide. To learn more about the drugs mentioned in this video, visit the link in the description.